Welcome to Rethink My Health Radio Show. I'm Dr. Gez Agolli, integrative practitioner, founder of Progressive Medical Center. This show is actually sponsored by Progressive Medical Center. If you're listening to my voice for the very first time, welcome. We're coming to you from our studios in Atlanta, Georgia, and what an exciting show today that we have. But before we talk about our show and my guest, as I'll introduce her momentarily, what is Rethink My Health? This show is about inspiring you to take action for your own personal health. And for those of you who have influence over your family, whether you're a parent, whether you have children, it's to inspire your whole family to engage in rethinking your health. Our country right now is going through a divide when it comes to healthcare. Sick care is not health care. Wellness is which is a team. We need a team approach. Whether you've tried functional integrative medicine, whether you've heard about it, we believe at Rethink My Health that integrative medicine is just good medicine. It's a combination of traditional medicine, which could use medication, surgical intervention when necessary, but also lifestyle medicine, wellness, looking at stress reduction, finding out what's the right diet for you. One size did not fit all. Our Maker made us uniquely in His image, and we have to find out what will work for you, the patient. So I want to inspire you guys, and hopefully I can galvanize you to take action. We've had several good shows already. We've talked about what is integrative medicine. We've talked about cancer, integrative oncology. We've talked about integrative diagnostics. And today's topic is a very important topic because a lot of awareness over the past 2 decades has been talked about it. We're talking about gut health. And before I introduce my guest, Dr. Cheryl Burdette, Dr. Burdette, I have a gut feeling this is going to be a great show. What do you think?
Absolutely,
yeah, okay.
100%.
So let me just start off by saying that my colleague, Dr. Cheryl Burdette, has been with our organization for 20 years. She is the educational director at Progressive Medical. She is the co-founder at Precision Point and educational director. She's an advisor for multiple nutraceutical companies. Zymogen is one of the leaders in looking at top-notch nutraceuticals that are science-based. Now, a lot of doctors out there that could be listening say, well, you know, nutraceuticals, it just could be a lot of expensive urine. I'm not sure if they're saying that now, but a lot of them used to say that. But now there's a plethora of research. And what we look for from a scientific perspective is what aspects of functional integrative medicine has science and how it's going to apply to you. So I encourage you, if you're listening to us, whether you're driving, whether you're at the comfort of your own home, be ready for some education. My philosophy has always been to learn something new every single day. So Dr. Burdette.
Yes.
Gut health. That's a very interesting buzzword today in 2025. And you know, you and I have been talking that for a long time. I remember talking to Dr. Bouquet, who's one of our medical doctors at Progressive Medical. He went to a seminar with Jeffrey Bland back in the late 90s. Oh my gosh, I'm really going back there now. I'm giving up my age right now, but if you can see me, you can probably see that I'm a very seasoned veteran. That he said to me, it all starts in the gut. And I said, well, okay, let me learn a little bit more. But what does that exactly mean, that all health starts in the gut?
Well, first off, I think actually you've never looked better. So, so the wisdom does you well, and then from there, I think that this has been a place that we've really worked around and thought about, and for decades we would use therapies directed at the gut, and people would get better. Sometimes they would get astronomically better when they had been told there was no other options, there were no alternatives. They could expect to have this chronic condition for the rest of their life, and likely it would get worse. And yet they work on gut-based strategies and the opposite occurs. And so then they go out maybe to some of their practitioners, other people they're working with, And they say, well, spontaneous remission. Leaky gut is not a thing. Gut health, that should not affect the brain, the bone, the back, all the various parts of the body. And so they were dismissed. And our science was dismissed, and maybe fairly enough at that moment in terms of calling it science, because, we didn't have as much evidence at a couple decades ago. But now you cannot stumble through the peer-reviewed research without finding things that will attach gut-based health to the rest of the body, systemic health, overall inflammation. And so we now realize we have this tool that we can work on that is as anti-inflammatory as some of the strongest medications out there, but minus the side effects. And this is a huge step forward for chronic disease in general, because it means that you are not left managing with just pain that's going to get worse, symptoms that are going to get worse, medications that are going to be more and more and more. There are many things that you can do that are empowering, that are gut-based, and that will reduce inflammation, not just in your stomach, not just in your intestines, but throughout your entire body.
Well, let's talk about that. And I totally agree with you, and I'm glad you're making that point right now, because a lot of you listening out there are going to say, well, I've heard about this gut health, and what does it exactly mean? Well, let me just start off by saying anatomically, from your mouth to the bottom of your rectum, your digestive tract is the size of a tennis court. It's just massive, right? When we were doing anatomy and we were looking and studying at the digestive tract, it was just amazing. Why do I say that? Because the digestive system, you are what you eat, but not necessarily you are what you digest and assimilate. And we have to look at the assimilation of these nutrients. So you can have the best diet in the world, whatever that means in a moment. We'll talk about that. You can take these great supplements, but if you have something called gut dysbiosis, you are going to not assimilate those nutrients. And that's so important, assimilation and digestion. And these enzymes, they are like catalysts. They're going to break down the nutrients. So, Dr. Burdette, I want to talk a little bit about gut dysbiosis, because we talk about gut health, right? And everybody said good gut health. But what does it exactly mean to have gut dysbiosis?
So in a nutshell, that means that you have an overgrowth of bad bacteria. Some of them can be somewhat normal, but you just have too many of them, all the way to things that are more strictly called a pathogen that we know are associated with certain symptoms. And so what we've learned is that part of aging is not just the time on planet Earth. The things that we associate with aging, loss of memory, more wrinkling, less connective tissue, plumpness and firmness, those are all things that are about aging, not just aging alone, but aging with inflammation. And so much inflammation starts in the gut, and dysbiosis can be a major cause of that. It's bacteria that shouldn't be there, that's in the wrong amount, that competes with our good bacteria, our healthy microbiome. And when that is occurring, it begins to create inflammation that doesn't stay in the gut, but spreads throughout the body.
And that's important. And the reason why I'm talking about dysbiosis, and for those of you listening first time, this is Rethink My Health, sponsored by Progressive Medical. And we're talking about gut health. And the reason I want to educate you on dysbiosis is that if you're out there and you've been taking enzymes, and you've been taking pre and probiotics, but sometimes your symptoms are getting worse, that is one of the clear signs that you have dysbiosis. And what do you do about it? Well, first of all, you have to find a skilled, functional, integrative practitioner. A lot of traditional doctors basically may just send you to get a gastric workup, could be endoscopy, could be a colonoscopy. We're not saying you shouldn't do that, but they're taking a picture of your anatomy. They're not really studying what's going on with the microbiome. The only way you can do that is by stool test. Also, there are a breath test. We'll talk about that in a second. And there's actually a blood test that we'll talk about in a moment that Dr. Burdette actually helped develop. And I think it's a game changer with that test as well. But I want everybody to understand, you could have changed your diet, which is a positive thing, don't get me wrong. When you change your diet, you change your life, right? But if you're still eating the wrong foods that your body could be rejecting or you don't assimilate, because you have this dysbiosis. So I encourage all of you to find a skilled, functional, integrated practitioner to order some of these testing. So let's talk a little bit about some of the testing. I think it's important to understand Let's just start off with, I know that a lot of patients out there have heard about leaky gut. What's the best way, instead of symptoms, of course there's a lot of symptoms for leaky gut. Why don't we first of all start off with a couple of symptoms of leaky gut, and also let's get right into the testing, because I know you helped develop a really important test.
Yeah, so one of my favorite markers that we can look at that identifies whether the gut is leaky is something called zonulin. And at Precision Point, we were one of the first to bring this to market. We worked and we piggybacked off Alessio Fasano, a researcher from Harvard, and some of his groundbreaking work. And what he found was that the gut had a lock and key situation, that zonulin was the key that would open up the lock. And in this case, making the gut more permeable. So if we'd had this conversation 10, 20 years ago, we didn't know about this biomarker. We couldn't measure it, we couldn't identify it. But once we could identify it, we could see that this marker that tells the gut to be leaky goes up even before the onset of pathology. And so this is really groundbreaking. So what Alessio Fasano discovered was that this marker of leaky gut goes up first, and then that creates a situation where things begin to leak into the body. That ignites the immune system, and that's what triggers things like chronic inflammation or autoimmunity. And his point was that you're not just a bag of genetics waiting to be your mother, your brother, your sister, but that you have to have this environmental impact for it to occur. And that environmental trigger is the leaky gut. When the gut becomes leaky and zonulin goes up, which we can now measure, that happens, and then you get autoimmunity. Then you get more chronic conditions, and the reverse is true as well. As we can lower zonulin and put it back in place, we make the gut less leaky, symptoms resolve.
Let's pause for just a second. You mentioned autoimmunity. How many patients out there are dealing with any type of autoimmune? Autoimmune diseases are on the rise, Dr. Burdette. They are a large percentage of our population, and a lot of physicians, what they're doing is that we're taught in medical school that the immune system's haywire, and they're not going to find out the why, but we're going to go ahead because patients are suffering with joint pain, gastrointestinal issues, whether they have Crohn's disease, could be colitis. This is all inflammation, right? And that, for example, these gastrointestinal diseases could be destroying your gut lining, of course, and that becomes permeable, as we talked about. And now you have all of these proteins leaking into the bloodstream, and then your immune system sees it as a foreign invader and attacks it. So yeah, it makes sense to shut down the immune system short term. What are the long-term complications about that? That opens you up to so many other diseases, and you wonder why cancer's on the rise. You wonder why other neurological and cognitive decline that we're seeing, and that's another topic we're going to talk about in the future, is dementia, Alzheimer's, all time. We're not just saying it's gut, but it's one of the main reasons as well. Once again, if you focus on gut health, a lot of these other areas of diseases may not disappear, but they will be a lot better. And that's why this marker, zonulin, is one of the markers with other markers as well. If it's elevated, now you can work with your practitioner, and you'll know now you need to be on a program for 3, 6, 9 months, a year, and you need to be on a maintenance, of course. It's like anything else. If you work out and you are very disciplined, and you're working out 3, 4 times a week, and you hit your weight loss goals, and you get your muscle goals, and you look really good, what happens if you stop working out again?
It goes away.
It goes away. This is about if you're ill, right? If you have an acute chronic disease, you have to be focused for a period of time. Then you need a maintenance.
Absolutely.
Okay? And the maintenance is just lifestyle. And the bottom line is, research has confirmed from a psychological perspective that if we do certain habits for at least 90 days, guess what? They stick with you. And one of the reasons why every year, we're coming up now to Thanksgiving, we're coming up now to Christmas, and we're having celebrations. And I'm not saying don't celebrate, and you may have a cheat day, but don't have that cheat day become a cheat week or a cheat month, or for some other people, a cheat year. And I'm looking at somebody in the studio here. But anyway, no cheat years out there. Okay, so we talked about dysbiosis, we talked about inflammation as well. I asked you earlier, I want to educate the listeners, what are some of the symptoms that are alarm? If somebody's listening right now, what are some of the symptoms they may have that could be leaky gut?
So this is very interesting. The symptoms are extremely widespread, and this is one of the reasons that conventional science dismissed the idea for a longer period of time, right? Because it should be a defined category, a group of things that happen almost universally in a person. For example, you have an allergy to something, and then you sneeze, or your lips swell, or you get shortness of breath. You have defined symptoms that happen from that allergy. You have rheumatoid arthritis, your joints should swell. It should have a defined picture. However, when the gut becomes leaky, it creates generalized inflammation throughout the body. That generalized inflammation washes over your genetics and causes your weak spot to be exposed. So you could have symptoms from depression to fatigue to joint pain to ankylosing spondylitis, and all of those could be related to leaky gut. So it's broad, but it gives us a broad way to intervene and to make most conditions out there better. If we can work on the gut, then we can decrease inflammation that drives a plethora of signs and symptoms.
Yeah, very good point, Dr. Burdette. I appreciate you sharing that. Okay, so we talked a little bit about that, the symptoms, the testing. We mentioned the intestinal barrier test with zonulin and other markers as well. Let's jump into food intolerances, of course. And I know that you're a big believer in that. What role does a food, we're not talking a food allergy for a second. So let's start off with that question.
Okay.
What's the difference between a food allergy and a sensitivity, a food sensitivity or intolerance?
Oh, everyone is the expert on their body. And so many people will figure out that a food is bothering them in some way. They'll meet with maybe an allergist. They'll do a skin prick test. They poke your skin. They see if it turns red. And they tell you you're allergic to a food or you're not. And 9 out of 10 times people will come back and say, oh, it didn't show anything, even though I know I'm bothered when I eat X food. And so this is because it's only a partial test. Looking at allergies is one way we react, but we also have these intolerances, as you mentioned. These are delayed sensitivities. They happen 3 to 72 hours after you eat the food, so it can get hard to figure out from a diet diary alone. Here you are 3 days out having a headache, and it's really breakfast from the day before, or even the day before that. So 3 to 72 hours, it creates this ongoing inflammation, this burn, if you will, that drives chronic disease. And so it's not the same thing as an allergy. You don't get an immediate symptom. You don't get shortness of breath. You don't get what's called an anaphylactic symptom. However, you get this ongoing inflammation that has the potential to make almost anything in your body worse. So you see sensitivities associated with depression, with headaches, but even, back pain. And of course, you can see them associated with gas or bloating or conditions of the bowel, irritable bowel disease, but you don't have to have a gut-based symptom to have gut inflammation that's starting there. That permeability may show up in you, like I said, as depression or fatigue, even in the absence of a gut symptom. So really, these sensitivities are so far-reaching, and they give us a way to tone down inflammation throughout the body, helping those people that just feel overwhelmed. I'm sick all the time. I don't feel like myself. I can't focus. I can't concentrate. I don't feel like getting out of bed. Right. When we tone down inflammation in general, all of those things stand to get better.
Yes, excellent point. When you have less inflammation, your body feels to thrive more, and you can be all kinds of different things, less pain. But there's so many different symptoms, a lot of crossover. I will mention that I do remember talking to one of the patients at Progressive, happened to be walking in the parking lot, and she came up to me. She visited with Dr. Bouquet and I believe Dr. Volsi, and she came up to me. She was so excited. She says, "Oh, thank you. I watched over the years of Progressive Medical. I came in. I went to multiple doctors. I went to a GI specialist. They said everything was fine with my colonoscopy, but I have all these GI symptoms. I have so much pain." And it ended up, Dr. Burdette, that, believe it or not, she had a sensitivity to cruciferous vegetables, right? So that's broccoli, cauliflower. But I mean severe, to the point severe. Now, if a doctor says to you, stop eating broccoli or cauliflower, broccoli is very healthy. It has something called sulforaphane. It's a fantastic vegetable, right? Here's the problem. Her body could not tolerate it. Literally, it changed her life just by eliminating that and then healing the gut. healing the gut with nutrients. So we're going to talk a little bit more about that. Dr. Burdette, do you have an example of a patient or another practitioner that you've coached on a patient that basically got great results by just eliminating food sensitivity?
Absolutely. So I will always be warmed by this kiddo who had costochondritis, and that means inflammation in the ribs. But hers was so bad that she was already on pain medications, and she was working with Emory Pediatrics, and they told her her next options are going to be more pain medications and likely a wheelchair over time. Well, her mom happened to be a pediatrician at Emory, and she couldn't accept that this was the only answer for her kiddo that was otherwise had been, a healthy person. So she came to our clinic. She was already using a cane on lots of pain meds, and the test showed what no 14-year-old wants to see, that they're sensitive to gluten. That means pizza, that means cookies, that means cake. And so this is a very hard thing for anybody. It's gotten a lot easier, but it's a very hard thing for anybody, and especially that demographic. I mean, you're hard pressed to go to a party and find anything that's not that food, or it has that gluten in it. So it was back and forth, and it was education, and she was not perfect initially, but when she was better, she saw how much less she hurt, and she didn't need pain meds, and she could stay awake longer at spend the night parties, and a lot of things got normal, even though not eating the pizza wasn't normal. And so I always like to talk about how now she walks around like a normal teenager, which is not one hand on a cane, but two hands on a cell phone texting as she's going, which is exactly what we, in this case, want to see. We want to see no wheelchair, and in this case, more cell phone. So, this isn't an allergy. This isn't something that would send her to the hospital immediately. It would just create ongoing pain that was going to further deteriorate her joints until she'd need more and more, and eventually her range of motion was next to nothing.
That's a great story, because it changed her life. And the reality is it changed her life because the mom thought outside the box. She tried traditional. We're not saying abandon traditional medicine. We're asking you, if you're not getting the results, to take a step back and think about other options. And that's what we like about functional integrative medicine. It involves critical thinking. It involves thinking outside the box. As a matter of fact, we don't have a box. We're completely outside the box. And that's a great example, because if I just tell someone, hey, stop eating broccoli, you're going to think I'm crazy, right? If I say, I think gluten right now is a lot of education, but how do you know you have a gluten allergy or sensitivity? Once again, an allergy is different. That's immediate. It can cause a plethora of symptoms. Anaphylactic could be dangerous, 100%, right? Hives and everything. But a sensitivity, you may not notice it, but it's cumulative, and it's going to affect the body. It's going to inflame the body. This is an extreme case, right? It's not everybody has an extreme case, but all these little signs and symptoms here, you're just not feeling right. It makes a massive, massive difference, Doc. That's a fantastic story, Dr. Burdette. Hey, this is Rethink My Health. Dr. Gez Agolli here, integrative practitioner, talking about healthcare matters that really make an impact on the quality of your life, okay? It's not only quantity, it's quality. You can have a long, healthy life. And right now, we're falling short in the United States. America spends billions and billions of dollars, close to 19% of our gross national product on healthcare, yet we rank one of the lowest. And a lot has to do with the way we're approaching well care, because our system is designed for sick care, which, trust me, if you're going to get sick in an acute situation, we have a great emergency acute, these doctors and nurses, ER, they're fantastic. But we're falling short on chronic disease, and we want to make an impact with functional integrative medicine. This is the future. We believe, we predict in the next 50 plus years that integrative medicine is going to be on the forefront. It's the way family practitioners will be practicing. It's happening. Americans are asking for it. We're seeing amazing results. And that's why at Rethink My Health, we want you to start thinking. That's the whole goal here, to galvanize you to take action. If you're looking for an integrated practitioner, go to Progressive Medical website. If you live out of state, there's a lot of great integrated practitioners across the country. As a matter of fact, we do offer virtual visits. So just go to our website, peruse that. When we get back for the next segment, we're going to dive a little deeper on probiotics, prebiotics, and we're going to touch up on something that a lot of practitioners don't talk about, It's called SIBO, small intestinal bacterial overgrowth. How does that play a role on gut health? You're going to find out. Hey, this is Dr. Gez Agolli on Rethink My Health Radio Show. Each week we come to you on multiple stations, educating you, getting to the root cause. We'll be back in a moment. Rethink My Health. Welcome back, welcome back. This is Rethink My Health Radio Show. If you're listening to my voice, if you're driving or it's comfort of your own home, we're talking about root cause. We're talking about gut health today. What an exciting show. I got joined with me in the studio here, Dr. Cheryl Burdette. And I talked about this at the beginning of the show, that I have a gut feeling this is going to be a great show, no pun intended. And the reason why, it's that most Americans that are looking for optimal health, I'm taking this supplements, I'm doing this exercising, I'm working on my sleep, I have a certain app. But these are all wonderful things, don't get me wrong. The body will heal synergistically when you do everything, but you have to have a foundation. And we believe in functional integrative medicine, that one of the foundations is good gut health. So we talked about gut dysbiosis, we talked about these bad bugs, and the digestive tract, which is almost the size of a tennis court when you spread it out. In dissection in medical school, you'll take a look at that and say, wow, this is amazing. There's so many different components to it, but we're actually looking, not anatomically when it comes to gut health, although that's very important to see if there's any type of anatomical problems, okay? Could be life-threatening. We're looking more on the inside. We're looking at the billions and billions and billions of microorganisms. The human body is supposed to have 85% or more of good bacteria, maybe 10, 15% bad. Unfortunately, it's flipped around in the past several decades. A lot has to do with our environment. A lot has to do with our food supply. You know, antibiotics, when they were discovered, was like the wonder drug. And we're not against antibiotics, but we've overused them. Why? It's in our food supply. It's in our cattle. It's in our water. It's everywhere, okay? It has imbalanced our microbiome. It has affected our ability, because these bacteria mutate and they become superbugs, so that when you have an acute infection, some of the antibiotics don't work anymore. So that's why it's so important to work on gut health now, being proactive rather than reactive. And I want to talk a little bit about why it's important to take a look at a probiotic and a prebiotic. Let's start off first of all, what exactly is a probiotic, Dr. Burdette?
Yeah, so a probiotic is something that you can take that is good, healthy flora that mimics the flora that's in your gut, or should be in the gut. It can work in a couple ways. First is maybe that bacteria that you swallow in the capsule adheres and begins to divide, or a second way it works is maybe it influences your own healthy flora to grow more. They can do both things, and so consequently there is an overwhelming amount of data in terms of what probiotics do for us. So, of course, they can help us with things like constipation and diarrhea or bloating, but you see good evidence in terms of probiotics helping us with anxiety or depression, helping us with memory and focus. Probiotics can decrease pain, especially abdominal pain, and can improve our overall immune system. So taking a probiotic orally has a huge drop off in terms of your risk of getting pneumonia or something respiratory. And on one hand, you think, well, the gut is over here, the lungs are over there. How can that work? Good, healthy flora sends these same signals throughout the body, the opposite of that dysbiosis that we were talking about. It sends positive, healthy signals. And so you see other compartments in the body respond well, do well, better immune activation overall because of what's happening in our gut.
Yeah, very important. And that's why I'm also a big believer in probiotics and prebiotics. Probiotics basically means pro, advancement, and bios is life. So it's the advancement of life in your ecosystem. It's really important to understand you have an ecosystem, and there's all kinds of checks and balances, right? And the body has different mechanisms, and the human body is just an amazing machine. Actually, call it human machine. It really is an amazing machine because of how the body can heal. And that's why when you start off with good gut health, the body has the ability to create this cascade of healing and different receptors. And that, as a matter of fact, I recently read an article, I want to believe it was in PubMed or one of the other medical publications, talking about now gut health is being researched for heart health.
Yes.
Which is fascinating. Have you heard about that?
Absolutely. So good healthy flora will decrease our absorption of cholesterol. It will put cholesterol in a form that's less sticky, so it can't stick to the inside of the arteries and make a plaque. Good healthy flora even sends signals to the rest of our body, to genes, to say don't make more triglycerides, don't make more cholesterol. So there's a whole host of things that our microbiome does for us in terms of cardiovascular disease.
I was speaking to a cardiologist, someone that we work with at Progressive Medical. We send Dr. Jason Reingold, and basically he's a big believer in probiotics as well, and he's an integrative cardiologist, conventionally trained, of course. But I think the research is beginning to reveal now that there's a lot of things going on with gut health and cardiovascular. We have to pay attention to this because the United States, I believe it's number one killer right now is cardiology diseases, heart disease. Although heart disease really in our country is really vessel disease. Yes. You have an occlusion of vessels, which actually will not get the nutrients and the blood flow to the heart and then pump all of this to the rest of the body, and you have oxygen deprivation and you set yourself up for a major episode. So it's really hardening of the arteries.
Yes.
And it's not just cholesterol has been demonized, it's really that oxidized cholesterol or that calcification. Now, we're not saying take a probiotic and I have heart disease. We're not saying that. What we're saying is the research is interesting, and the healthier the microbiome is, the less chance you could have cardiovascular disease, because really cardiovascular disease is inflammation disease.
And I like that you mentioned that vascular component, because one of the major things that damages the inside of the vessel is not just cholesterol, but little bits that come from dysbiotic bacteria or dysbiosis in the gut. Something called LPS, it drifts off the body of the dysbiotic bacteria, and when the gut is leaky, it comes into the system more. It's one of the major things that damages the vessel. It's one of the major things that causes that cholesterol to be more sticky in the first place. And not only does it damage the vessel, it damages the heart proper. And so there's a huge tie between what's happening in the gut and what's happening cardiovascular speaking, and it's back to good healthy flora and getting rid of the bad guys, that dysbiosis. In fact, when people talk about the increase of cardiovascular disease as we age, again, it's not getting older, it's getting older with dysbiotic bacteria inside of you, and your good healthy flora competes with that and keeps it at bay.
And that's why it's an investment to think outside the box. It's an investment to take a look at your gut health. Because at the end of the day, if you're dealing with these advanced chronic diseases, listen, heart disease is very prevalent right now in our country, and we're looking for all kinds of strategies. And there is not one drug. I know right now a lot of you listening out there are going to be taking a statin drug from your cardiologist, and you think, I'm covered, I'm good. No, that's only one component. It's not the cholesterol. We've even seen patients right now that have episodes, whether it's an MI, different type of heart attack, stroke, where they've been on a statin drug. So there's something else going on as well. Could be gut health. We know for sure, without a shadow of a doubt, the research has confirmed that inflammation, chronic inflammation, is the gateway. Now, where's that inflammation coming from? Is it the microbiome? Is it dysbiotic? Is it some type of delayed sensitivity? We talked about certain patients before. Dr. Burdette mentioned on a previous segment before our break, we had a patient right now walking around in a cane. It was one food with gluten, right? If we said to that person, just stop eating gluten, they may just try it because gluten-free right now is fashionable, but are they being strict? No, they are not, because they didn't see it. When you don't test, you just guess. And the way human behavior works, if you don't see it, you're not going to take it seriously, right? When do you actually take it seriously? When you see your cardiologist like Dr. Reingold, he shows you the echo, he shows you the plaquing, and he's basically saying, listen, you're one step away from having a heart attack. You're going to take it serious then. But do you think this happened overnight? Years and years of accumulation. That's why diet and exercise consistently, the right type of diet, the right type of exercise. We're going to devote a whole segment in the future to what's the right type of exercise, because everybody's a little different. But there are some common denominators, okay? We can talk about that. But listen, your movement, right, is medicine for your body. If you're not moving, you're not well, okay? So do something out there, take action. All right, Dr. Burdette, this is really exciting information here. All right, so I talked a little bit about SIBO, okay? If you've never heard of SIBO before, small intestinal bacteria overgrowth, Dr. Burdette, educate our listeners, number one, what is SIBO, how does it happen? What part of the digestive tract does it affect? And is there hope? Because a lot of patients suffering from SIBO, it's very, very difficult to get under control.
So SIBO is an acronym that stands for Small Intestinal Bacterial Overgrowth. And we were just talking about dysbiosis, which is bacteria in the gut. That tends to be more in the large intestine, and this is in the small intestine. So many of the concepts that we just talked about, how bad bacteria creates inflammation, still applies here. It's really just a location of where it's at. Now, the big unfortunate thing about the small intestine is this is where most active absorption takes place. So if you have an overgrowth of bacteria in your small intestine, you're not getting the nutrients that you should. It begins to wear at the lining, and that can make the lining leaky. In the lining, we have things like brush border enzymes. We have other enzymes that break down histamine. So now all of that gets worn down. Everything begins to hurt as you eat it because you don't have the lining in place that we should. It's more atrophied. And this bacteria sits in the small intestine and grows more than it should. So think about if you've ever baked yeast, right? It causes things to rise, to get bigger, to ferment. And that's essentially what's happening with this bacteria in your gut. It's fermenting. So you feel that. You bloat from that. You feel miserable from that. You're wearing down your lining so you don't break down foods as much anymore. So more and more things become irritating to you. You're able to only eat a handful of things without feeling discomfort, and it's just miserable. It's no good way to live. However, there are lots of things that can be done. First of all, we can measure it. We can diagnose it. It's called a breath test. We do that at Progressive Medical. And now you know, do you have it or do you not have it, so that you know the next steps. Also, how long do you treat? Do you need to treat it for 4 weeks, 6 weeks, 8 weeks? All of those are possibilities, but when we have a good diagnostic test, we can track it, we can treat it, and we can make sure that it doesn't come back again. So SIBO is essentially dysbiosis, but higher up in the small intestine, where unfortunately it can wreak just as much havoc and in some ways more.
We've actually seen that at Progressive over the years. A lot of times patient comes in, they're doing a gut health workup, and they've done everything diligently, and they're just still not getting better. They're not 100%, and it's usually SIBO. And that's a simple breath test, as you said, and it's measuring hydrogen and methane gases in the small intestine. As Dr. Burdette mentioned, that small intestine is so important, okay, because it actually is where you're going to be taking your food sources, right? Look at the stomach as a holding tank. The stomach is a holding tank. And the body, when you're about to eat, the body starts to release enzymes, amylase, protease, lipase with the saliva, because just the thought of eating, right? That's why it's so important. When we eat, you eat in community, but you can eat by yourself as well. When you do that, you're releasing these enzymes, but you're also releasing pepsinogen and hydrochloric acid, which is so important, because I'm going to talk about that in a second. But what ends up happening is that when that food goes into the small intestine, if you've got that bacteria, you're not going to make essential amino acids, you're not going to make essential vitamins, and you're not going to make essential minerals. And minerals are cofactors and the spark plugs of life. We do not pay enough attention to minerals,
Very
right?
true.
So inadvertently, minerals do play a role in gut health, right? Because without it, the body's not going to make enzymes, it's not going to make vitamins, it's not going to make hormones, it's not going to make amino acids. And these are all essential. These are the building blocks. Amino acids are the building blocks of the human body. It's so important that you have to be able to thrive with these nutrients. That's how we were designed. All right, so talked about gut dysbiosis, we talked about leaky gut, talked about SIBO. I do want to talk a little bit about now, because you see a lot of patients across the country and probably the world right now penetrating that they're on all these medications and they're taking all kinds of things to block acid. Let's talk a little bit about that, because I do believe in gut health, that digestion is critical. As I mentioned, you are what you assimilate, not what you eat, what you assimilate and digest at that cellular level. What role does enzymes and hydrochloric acid, what exactly role does that play in gut health?
So, of course, we probably figure out that enzymes and hydrochloric acid help us to break down our food. And we have to break food down into the smallest bits for two reasons. One, to get nutrition from it. But two, if we don't break it down into the smallest little bits, it looks weird to the immune system. It looks like a foreign invader, something that shouldn't be there. And it can trigger even autoimmunity, because now the immune system starts to attack food, which it shouldn't, and that cross-reacts with other things in the body. So those enzymes are hugely important. We can flip it around and say, what happens when you block enzymes? So these are some of our medications called things like PPIs or Tagamet. And people will take them when they're having more heartburn or reflux, because it logically follows that if you are burning, maybe there's too much acid, and shut the acid off. Now, unfortunately, that's actually not always the case, and we can talk about that, how actually having not enough acid can cause some burning. But when we look at what happens to people on PPIs when their enzymes have been blocked, you see an increase in allergies, you see an increase in food sensitivities. Some of the first research has come out that showed PPIs are associated with more depression because you're not getting the nutrition that you need. You also see an increase in things like osteoporosis. That makes sense. We're not absorbing these minerals that work so well. However, the drugs even directly affect the energy-making machine in the cell, in the bone, something called the mitochondria. So there's layers and layers and layers of side effects to these medications, and all because you're blocking enzymes, which we would have to guess are essential for good nutrition in the body.
Absolutely. It's a great point, and I totally agree with you. And once again, if you take a look at the research is very clear that a lot of these proton pump inhibitors were actually designed for short-term usage. Short-term usage, 2, 3, 4 weeks.
Yes.
Allow the esophagus to heal, okay, because you don't want esophageal erosion, of course, and sometimes too much acid reflux, because there's a reason why. It could be, I know this sounds counterintuitive, not enough of these enzymes are hydrochloric acid, okay, in appropriate dosages. So it was really designed short-term use, but now patients are on it for years and years and years. They can't get off of it, okay? And they end up with all of these nutritional deficiencies, which is really not a healthy way to live and to thrive. That's why I think it's important to take a step back and at least revisit and taking certain enzymes, okay? If you're going to take hydrochloric acid, you definitely should go with a skilled practitioner that knows the dosaging on what to do, even though it is over the counter. Too much is not a good thing either. There's a balance on there. So great point, Dr. Burdette.
And did you know those PPIs, I mean, I know you know, but did our audience know those same things that you're taking to decrease burning in your stomach cause your gut lining to atrophy? It literally wears it down. So now when you try to get off, it's worse than it was before. So you absolutely need to work with a skilled practitioner, figure out what the problem was in the first place, and then you'll have an exit strategy.
Heal your gut, change your life, you will reap the rewards. And we see this every single day. It does take some time. This is an investment. Yes, you have to think outside the box. Yes, you may have to change your diet. You may have to get better food. You may have to do certain testing and invest. But what's important, okay, is to have a healthy, long, vibrant life. And we believe it all starts in the gut. And there's other great things we're going to talk about hormones. We're going to talk about peptides. We're going to be talking about other chronic diseases. But foundationally, Dr. Burdette and I believe that gut health is one of the key areas to focus on and invest on. Because when your digestion is working properly, the body is thriving on all cylinders. And this is what's exciting. So, you know, we've talked about this before, Dr. Burdette. Talked about chronic disease, that inflammation and infection. I talked about the 4 I's. But we're talking today about inflammation and infections. Number one, test, right? If you don't test, you just guess. Test. If you've got an infection in the gut, it has to be treated. And then we will use medication then. You could use botanicals, but there's a short period of time that medication, whether it's an antibiotic or antifungal, antimicrobial, just get rid of those bugs, and then you start to rebuild the army. Think of that, your microbiome as an army that's working for you. And that's your immune system, okay? It all ties in. You don't want to get this devastating disease. You want to do everything possible now. Even if you get this devastating disease, at least you're in a healthier position to fight it. right? And that's what's really important to understand, is that the gut health is critically important.
Yeah, I've been fortunate enough to practice for at least a couple decades at Progressive Medical, and I always feel like a kid in a candy store there, because we have all the best procedures, all the best IVs, all the best laser therapies and oxygen therapies, et cetera, and we will use those for sure, but we also use them on a backdrop of working on gut-based health, because it is foundational to everything else that you do. And so many things will continue to improve when you pursue this, helping you to stay in remission for a long period of time, when the alternative is various medications that are immune suppressive, that set you up for other infections. This gives you a way to build your health, not to suppress the immune system, and quite frankly, actually not just to augment it either. But when we're centered around gut-based health, you balance immune function. And this is something that standard medications don't do. They're either up or down, but not putting the immune system back in balance. Most of the cues that balance the immune system throughout the body come from the gut. And so when we work on that, we're able to treat autoimmunity, we're able to treat infections, we're able to treat other imbalances of the immune systems that can be a risk factor for cancers. If we need to improve immune health, you have to work with gut-based health.
Absolutely. Hey, this is Rethink My Health radio show. Dr. Gez Agolli joined alongside Dr. Cheryl Burdette. We're talking about root cause. We're talking about gut health. Think inside the box. Take action. If you're suffering from any type of chronic diseases and you've not had a gut workup, it is foundational, okay? It is critically important to do the necessary steps. Yes, it's an investment of time. Yes, it's an investment of resources, but your health is worth it. And the reality is you have to find out what's causing inflammation, what's causing the pain, okay? And this is a great area. Yeah, there's great tools out there. Dr. Burdette said we got all these bells and whistles. All of these therapies we absolutely love, but foundationally gut health. Every single patient that we talk to, I don't care if you've got autoimmunity, I don't care if you've got allergies, cancer, something as serious as cancer, cardiovascular, we all start with evaluating the gut and other areas such as oxidative stress. And we're not sitting there telling you, hey, heal your gut and all these diseases are going. No. We're not saying. What we're saying, though, you put your body in position to get momentum and to become resilient. Because a lot of these diseases, chronic diseases, which is all-time high right now, they are robbing Americans' vitality, and they're robbing the quality of your life. And that's what we're looking for, Dr. Burdette, is the quality. Yes, you want good quantity, but if you have quantity of life and you have no quality, what's the point, right? Okay, so you want to do everything possible. And there's so many strategies out there, and this is a great way. Dr. Burdette, I want to thank you for this great episode on educating our listeners on Rethink My Health radio show. Any last words of advice on gut health?
Yes, that we are not merely aging, but we are staying on planet Earth with a compromised microbiome, more dysbiotic flora, less good flora. And so when we put that back in balance, we can reverse the inflammation that causes the aging in the first place. And you see it over and over. People with a diverse microbiome live longer outside of the disability zone, don't go to hospitals as often, don't get infections as much. And so gut-based health is critical for overall health.
Absolutely. Thank you, Dr. Burdette. This is Dr. Gez Agolli at Rethink My Health radio show. We've had some great shows, great episodes. If you listen to us every week, stay tuned, because we're going to be interviewing the next show with a good friend of mine, Jordan Rubin, who is the author of the Biblio Diet, and he also was the Maker's Diet author, and he's opened up all kinds of nutraceutical companies and organizations, Ancient Nutrition. He is an expert, and he's a big believer in gut health, by the way. As a matter of fact, his story is powerful because he had Crohn's disease and he had cancer, and he beat it both. And one of the foundational principles was gut health. So you can do it. You can conquer any type of disease. You can be resilient. Hey, this is Rethink My Health. We want you to take action. And remember, a cheerful heart is good medicine, but a crushed spirit dries the bones. Proverbs 17:22. God bless you guys, and we're going to see you next time here on Rethink My Health.